May is National Stroke Awareness Month, a great time to learn about the signs of stroke and what you hopefully can do to prevent one. Joining us now from Catholic Health St. Francis Hospital is Dr. Jeremy Liff, Director of Neurointerventional Surgery. Dr. Liff, thank you for joining us.
It's my pleasure.
Like I said, so important. First of all, just tell us what a stroke is, who's at risk?
So a stroke, when someone's having a stroke, part of their brain has stopped working, and it stopped working abruptly because it's not getting enough blood flow. And usually that's because there's a blood clot in the artery. And so when the part of the body that's controlled by that part of the brain will also stop working. And so, for instance, someone's arm could go limp. And the key is it's totally abrupt, it's sudden onset, and it's painless. There's a mnemonic, which is called FAST, which stands for facial weakness and arm weakness and slurred speech or speech change, and the T stands for time. But the key is a sudden dysfunction, which seems to come out of nowhere. 1 minute someone's fine, the next minute they're paralyzed, and there's no pain. And T stands for time, because the key is getting that patient to treatment as fast as possible.
A lot of people may just not know that and may ignore those symptoms. The sooner they call the 911, the better the outcome for treating a stroke?
Absolutely, because the treatments we have for stroke essentially are trying to get rid of that clot so that part of the brain which is not working gets its blood flow back and starts working again. But there's a point of no return where even if you can get that blood restored, if you've waited too long to do it, it's not going to help. And because of that, the most important thing is to get the patient to treatment immediately. I can't tell you, unfortunately, how many times in my career I have seen patients with stroke and the symptoms started the day before, and their family member tells me they thought they would just sleep it off. Wow. So that is not a good decision. You must seek treatment immediately to give yourself the best chance.
When you say you've had a stroke, when we talk about time, you want to get treatment immediately, but time with an hour to 3 hours, I mean, is there a window there at all?
That's a great question. If you think about a stroke like a heart attack, a stroke is like a brain attack. From the minute your symptoms start, kind of a stopwatch is started. And everyone's watch moves forward at their own pace for a variety of different factors, but no one does better later. So there are two different types of treatments you can receive for stroke. One of them is a medication to try to bust the clot and restore blood flow that's given through the IV, and you have to give it within about 4 hours of onset. The second one is a neurointerventional surgical procedure in which a blood clot is removed from the brain with a catheter by a specialized doctor like myself. And that can be done a little bit later in the process, but we are talking about hours from the time of onset, up to 8, 12, and sometimes even 24 hours, depending upon the patient's brain. But the sooner, the better, no doubt about it.
Wow. Let's talk about recovery. You've had a stroke. What is recovery like for a person? Physical, occupational therapy? Will everybody need something?
Well, in the best case scenario, in the tremendous, almost semi-miracle scenario, sometimes patients come in and they are totally disabled and paralyzed, and if we can get the clot out, they walk out of the hospital themselves, then they don't need therapy. But a lot of times, even if patients do have improvement, yes, they definitely need some therapy. And what happens is that sometimes once they're stabilized, they can be transferred to an acute rehab center where they'll get specialized intensive therapy for a couple of weeks as an inpatient setting. And then transition back to home and then get physical and occupational therapy, either going to an outpatient center or having a therapist come to their house. But there's no question that physical therapy is really the mainstay of treatment for disability after the stroke has occurred.
Well, let's talk about preventing a stroke. What do we do?
There are two main reasons commonly why people have strokes. One is that they have damage to their arteries. And the predisposing factors to damage to brain arteries is the same predisposing factors to damage to heart arteries. Cardiovascular disease and cerebrovascular disease are very related. So things like out of control blood pressure, diabetes, which is not well controlled, high cholesterol and poor diet and smoking. Those are the four major things. So having those things under control as a way to prevent stroke primarily is very key. The second most common reason why people have stroke is actually it's related to their heart. And either they have a weak heart, which predisposes them to eject a clot up to their brain, or they have a very common arrhythmia called atrial fibrillation, which also predisposes a clot going to the brain from the heart. So making sure your heart is in good shape and seeking expert medical attention and cardiological attention if you do have heart issues is also extremely important.
Well, this month, St. Francis is offering free screenings. They're testing glucose, cholesterol, blood pressure. Extremely important for everybody to always have those tests done because it could show you're at risk, right?
No question about it, not just for stroke, but for any type of heart disease. Diabetes, for instance, affects all of the organs of the body that need blood, which is essentially all of them: the eyes, the brain, the heart, your fingers, your toes, the kidneys. So the screen is a great thing. Make sure that you're okay, and if you do have high blood pressure, you do have diabetes, make sure you get those under control. It's really the most important thing, the healthiest thing you can do for yourself.
Wow, so important. Dr. Liff, thank you so much. And everybody remember, be fast. Important.
Fast.
Thank you
Yes.
so much.